Hello and welcome to CTV News Across Canada for Friday, March the 28th. We've got top local stories from coast to coast, stories that affect you and our country. Thanks for joining us.
Calling the latest tariffs unjustified and rejecting any attempt to weaken or break Canada, Mark Carney paused his campaign and met with his cabinet in Ottawa. Trump has requested a call with Carney hours after he imposed 25% tariffs on all cars made outside the U.S.
It's about making America great again, making it strong and prosperous again.
The Prime Minister says he will use that call to discuss how to protect workers and build both economies.
I will make clear to the President that those interests are best served by cooperation and mutual respect, including of our sovereignty.
These latest levies, set to kick in on April 2nd, are causing anxiety on both sides of the border.
It's quite a punch to the gut.
With unions in the U.S.
150 years of economic theory that really show clearly that tariffs are dumb.
And in Canada, where elbows up t-shirts are part of a rallying call.
These are our jobs. These are our plants. These are our communities. And this is our country. And we are fighting for all of it.
Hey, how are you doing, man? On the campaign, with the NDP promising tax breaks and the Conservatives TFSA top-ups, much of the attention was on the trade war.
My message to President Trump is knock it off. Stop attacking America's friends.
Donald Trump stabbed us in the back. It's a betrayal. It's a betrayal, and Canadians are angry.
Carney says Canada will have to fundamentally reimagine its economy and learn to succeed in a drastically new world.
The old relationship we had with the United States, based on deepening integration of our economies and tight security and military cooperations, is over.
But he refused to tip his hand, saying he will wait to see what Trump actually does when the tariffs are supposed to kick in before making his counter moves public. St. Alexander, CTV News, Vancouver.
So it looks amazing.
So Claude, congratulations, sir. Beautiful new truck.
A top-line Ram Longhorn.
It's got more bells than I can even mention.
And for Claude Brisson, there's no question now was the right time to buy.
I don't know what the difference would have been, but probably a lot.
They've really ripped us off at levels that nobody's seen before.
On Monday, U.S. President Donald Trump announced the latest round of tariffs, 25% to imported vehicles.
It's terrible. It really is, because we should be neighbors. We should be friends.
A move which could ripple across Canadian and U.S. automotive markets, driving costs higher.
The tariffs, if they came in, don't affect what we already have in stock. And dealerships already have inventory on the ground.
Sean Gibson, general manager at Ottawa Saint Laurent Jeep and Ram, says any potential impact is likely down the road.
The unknown is typically what paralyzes people.
Now, whether or not the full amount of this tariff is actually imposed, that's yet to be seen. And for many, the only thing that is certain is uncertainty.
This part came from the dealer. With the pricing, with the inflation, with everything that's coming.
At Speedy Auto Repair, George Miscampbell has seen an uptick in customer requests.
People are holding on to the older vehicles longer, trying to maintain them better, as opposed to getting into new payments. And even the price of this has gone up.
But looming tariffs mean at some point, most parts will cost more too.
It'll be everything from tires to brake parts, anything that gets trucked in here, which is literally everything.
Look at the size of this back seat.
An incentive for Brisson, his purchase today avoids any current or near future economic volatility.
I'll have this for almost 10 years, most likely 10 years. That's usually the length I have a vehicle.
Now, untangling the deeply connected U.S.-Canada auto market and its global supply chain would come with certain challenge, but experts say, regardless of the outcome, the cost of a new vehicle will rise no matter what. Patricia.
All right, CTV's Tyler Fleming live for us tonight. Thank you.
A mobile command center and police cars surround a large home on Heritage Road near Embleton. The family home, say investigators, in which several people were present at the time of a fatal shooting.
It's just after 11 p.m. Officers arrived on scene with Peel paramedics and Brampton Fire. They located one male in his 20s that had been shot.
One man critically wounded, 2 other adults sustaining non-life-threatening injuries.
Suddenly we see a lot of lights and a flashing, and so the police lights were out there, and suddenly there were 10 old police cars.
Area residents say they didn't hear the sounds of gunfire.
Not a thing. Didn't even hear the sirens, even though it's 2 doors away.
Still, the shooting in this quiet, relatively rural Brampton neighborhood, very disturbing.
It's not great, but we just get it's a large city. We've had, Brampton's now 1 million people. It's unfortunately a sad fact of life.
It's a very unfortunate event to hear being around in this kind of situation. Basically, usually Canada being a very safer country, right? We are hearing these kind of things more often nowadays.
Emergency crews would not say whether the 2 victims who sustained minor injuries were shot, but the victim in his 20s who was rushed to hospital in life-threatening condition would be pronounced dead in hospital. No suspect information has been released. The homicide unit has taken carriage of this investigation, and officers have been canvassing the area looking for surveillance and dash cam video. Of course, anyone with any information is asked to contact Peel Regional Police. Reporting live, I'm Janice Golding. Now back to Michelle.
Thank you, Janice.
Let's get the landfill going to bring our daughter home.
An emotional plea from the parents of Ashley Shingoose, a woman missing for the past 3 years, now identified as one of the victims of Winnipeg serial killer Jeremy Skibitsky.
She was a loving, caring person. She'd do anything to help other people.
The 31-year-old mother left her home in St. Teresa Point First Nation due to a lack of housing in the community soon after she began struggling with addictions and disappeared in March 2022.
It's so hard to lose your daughter, not knowing where she is.
Ashley's parents, Teresa and Albert Shingoose, searched for years in hopes of bringing her home, and then came the news. 4 women had been murdered by a serial killer in Winnipeg: Rebecca Contois, Morgan Harris, Mercedes Myron, and at the time, an unknown Indigenous woman.
We wanted her to have a name because she deserved it, because she was important, because whoever her family was, her family loves her.
Indigenous grandmother Thelma Morrisseau gifted the name Mashkoti Biziki Ikwi, or Buffalo Woman.
Thank you for naming my daughter Ashley.
For Albert and Teresa, knowing their daughter is Buffalo Woman has brought some relief.
It's good to hear where my daughter is now.
But now their attention has turned to the Brady landfill, where police believe Ashley's remains were taken.
The landfill is not the burial ground for anybody. We're not garbage. Nobody's garbage.
With a promise from Manitoba Premier Wab Kinew, along with the City of Winnipeg and the Winnipeg Police, to search that landfill, Ashley's parents hope that happens as soon as possible.
She will be found, that she will come home.
Now, merely here at the Mamawe Chita Center, the sacred fire for Ashley Shingoose is expected to be burning for the next few hours as folks come and go to offer support for the family. But along with this support, they're also calling for urgent changes, like the implementation of a red dress alert system that they would say would prevent similar tragedies from happening in the future. These folks here will be spending the next few hours together remembering Ashley Shingoose and honoring her life. Marilee, back to you.
All right, thanks for this, Stanton.
The entire bill needs to be revoked. Giving an exemption to the post-secondary sector is not enough.
This PhD student says opting universities out of a law that would have required schools, cities, and health agencies to get provincial approval before accepting federal funding is not enough. Upon its introduction, Alberta's premier said the law was needed because Ottawa...
They fund in a certain way, based on a certain ideology.
The exemption shows that after months, the UCP government simply could not find any evidence that federal research funding favored liberal research or ideologies.
Alberta's advanced education minister disagrees.
This was a tremendous exercise for us to understand exactly what those federal transfers were, and
And even though these exemptions are in place, we're still going to have a close look at some of these federal transfers that are coming in.
This is actually going to be a huge detriment for rural Alberta and for our municipalities, and some really missed opportunities and cancellation of projects.
The president of the Rural Municipalities of Alberta calls the law concerning and says rural cities didn't ask for it.
It's like Big Brother's overwatching us, and we don't see any good coming from this legislation.
The inability for local governments to actually accurately represent the people that they were elected to serve.
Edmonton City Councillor Andrew Knack says the law erodes the autonomy of local governments.
The whole bill should be scrapped. No.
The Municipal Affairs Minister says he is not considering further exemptions and says the law will ensure Alberta cities get fair funding from Ottawa.
We're committed to making sure that they don't lose any legitimate penny that's coming to them.
The legislation takes effect next Tuesday. Shalane Skalski, CTV News, Edmonton.
The journey to fight a rent increase is a long one.
We can't even answer the calls. There's days where we get 30 or 40 calls.
Manuel Johnson says lawyers like him who represent tenants are overwhelmed with demand for their services. The housing crisis has gotten so bad, he's not surprised by the latest figures from Quebec's Housing Tribunal. Requests for rent revisions at the TAL tripled from around 7,000 in 2021 to 21,000 last year.
We have horror stories where it's been 4 or 5 years and we still haven't gone forward with the rent increase from 2021, 2022.
The TAL approved an average rent increase of 5.9% this year, the highest in 30 years. Tenants, though, are allowed to refuse, at which point their landlord can take the case to the TAL to set a new rent. Margaret Van Newton with the Housing Committee Project Genesis says tenants are getting desperate.
People are not seeing their income increasing by 6% or 7% or 8%.
Van Newton adds the increases compound year after year, so it doesn't take long for homes to become unaffordable.
The way that the formula is set up is that there is this self-perpetuation of higher increases.
Provincial Housing Minister France-Hélène Duranceau says they've increased the number of judges at the TAL.
We need tenants and the landlords to better understand each other and meet, discuss, and find resolution of problems to avoid going at the TAL.
But advocates say mass social housing, where rent is based on a tenant's income, is needed, as well as stronger rent control measures, including a rent cap.
It's like a tsunami, and we're like the lifeguards on the beach. We can save a few individuals, but we can't stop the wave. The only one who can stop the wave is the government.
A crisis he believes will only get worse at Quebec's busiest court. Angela McKenzie, CTV News.
Eva Zali Sadat worked as a social researcher in his homeland of Afghanistan before the Taliban forced him to flee to Canada a year ago. He's been taking English classes at Bow Valley College and is devastated to learn the program is being cancelled at the end of term.
I feel so sad. It affects so negative on us.
The college announced in late February it was discontinuing its Language for Newcomers to Canada, or LINK, program at the end of April. It's designed to develop English language reading skills for daily life and work. The college says the difficult decision was made after Immigration, Refugees and Citizenship Canada significantly reduced funding, a move that will impact around 1,300 students and 120 staff.
I feel shocked, feel so sad, because I know just the level 6 is not enough for the work.
Janice McCrimmon used to teach English at Bow Valley and launched a petition on behalf of students who she says can't speak for themselves and her former colleagues. She hopes the province will intervene and the school will reconsider.
They are one of the largest providers of ESL in the province, and if they close this program, it will be a huge loss to our community.
It comes as around 20 staff at Lethbridge Polytechnic learn how their jobs will be affected this week come June when the school's English Language Center closes, affecting around 200 students. The president and CEO says it's also the result of funding cuts to LINK from Ottawa.
I can't stress how desperate the situation is right now.
Despite the reduction in federal funding, demand for LINK programs are high. The Center for Newcomers program is at capacity with 900 students and another 900 on the waiting list.
I've been working in the sector for 18 years, and this is probably the worst time in terms of the wait waiting list.
Discouraging for students like Sadat, who will have to be reassessed by the government before he can be added to a new waiting list.
We want to be a very useful and effective citizen in here.
Opening Tidewater Books in Sackville, New Brunswick 30 years ago, Ellen Pickle has never faced anything quite like what the industry is facing today.
Over the years, the sky has been falling. When audiobooks came out, people said, oh, printed book will go. And I said, no, it won't. And it hasn't. But this is truly more terrifying because it affects the entirety of our book ecosystem.
For independent bookstore owners, it's not the threat of tariffs from the United States that are causing worry. It's the retaliatory ones that Canada plans to impose.
I don't know how this is going to impact American business, to make them want to lobby the Trump administration to back off.
Booksellers say that the majority of books, even by Canadian authors and publishers, are printed and stored in the United States. For both Higgins and Pickle, they say at least 80% of their stock is coming from the States. At this point, the hope is that the publishers will be able to absorb the potential blow.
We could absorb a little bit, but to be honest with you, 25% represents more than half of our profit margin. So we can't absorb very much or for very long. So ultimately, I'm frightened that this is going to get passed along to consumers.
However, it's not just a jump in price that's causing concern.
If the independents start closing and all you've got left are the giants, the big American giant, they're not going to support Canadian books.
Right now, independent bookstores, customers, and the Canadian Independent Booksellers Association is lobbying the government in hopes that something changes before next week.
All we can do at this point is try to make them understand that if they impact Canadian books, they're impacting Canadian identity, Canadian history, Canadian culture. If we don't have those books, we don't get them in the schools, we don't get them in the libraries, we start losing what makes us unique in this country.
Alana Pickrell, CTV News, Moncton.
Medetomidine is a tranquilizer used to sedate animals, only approved for veterinarians. But now it's showing up in Canadian street drugs, first detected in 2022 with 6 cases. The latest numbers provided to CTV News from Health Canada show medetomidine identified more than 1,200 times in illicit drugs.
It creates an extra level of overdose response because it doesn't respond to naloxone.
So why are suppliers adding sedatives to fentanyl?
Because there's a perception that it makes the high better. It actually leads to a lot more deaths and harm.
Just before Christmas, RCMP in Newfoundland found medetomidine mixed with fentanyl, calling it an extremely lethal combination. Showing up as a blue powder, a trend in recent drug busts, fentanyl appearing in bright colors. Public health researcher Jillian Cola says it's a way for sellers to distinguish fentanyl from other white powder drugs.
So, for example, it was to prevent somebody who wanted to buy crystal methamphetamine from accidentally buying fentanyl. So you dye the fentanyl bright blue, bright purple, bright pink.
Saskatoon's police chief says the colors may represent different sellers.
There is, I hear, some signature to it, the addition of colors to represent, a particular person or group.
The Canadian Centre on Substance Use and Addiction says there's been a shift from plant-based to synthetic-made drugs with more local production.
These chemicals that go into drug making are unfortunately quite easy to get.
So why would drug suppliers kill their clients?
When we're dealing with people who don't have a lot of experience with this, don't know exactly what they're doing, it's really easy to make the wrong batch that kills a lot more people.
They do not care. It's quick money. It's all about the money. They do not care about people whatsoever.
The police chief says testing is crucial, so emergency crews can know what's in the drugs to properly respond in a situation where every second counts. Laurel Woodward, CTV News, Saskatoon.
Wes Reinhardt relies on OneCare to get him to important appointments each and every week.
I have a rare blood clotting disease, and sometimes I need rides to London to see specialists.
so this is pretty important for me.
One Care Home and Community Support Services does a little bit of everything. They deliver Meals on Wheels, they deliver home care and personal support services. But a big part of what they do in Huron and Perth County is move seniors and those with mobility issues from point A to point B.
We need to help people where they need to go, especially in our rural community. And we help people get to their medical rides, vital things like dialysis, and to our adult day program, which we know combats social isolation as well as provides caregiver respite.
Last year, One Care here on Perth provided nearly 50,000 rides using their 16 accessible vehicles. But more than 3,000 vital rides had to be canceled due to older vehicles in need of vital and costly repairs.
We had 2 vehicles in the last couple of months that had to have their engines replaced. So this is an ongoing issue that we need to rectify.
One Care says they urgently need to replace 3 of their accessible vans as soon as possible, just in order to maintain their current level of service. 80% of their nearly $15 million budget comes from the Ministry of Health, but the rest is covered by client fees and fundraising, which One Care is in the midst of trying to do right now to help pay for new vehicles and keep the ones they have on the road.
Our campaign is ambitious. We're trying to raise $500,000. So we are appealing to the public. One of the things that we are doing is a 50-50 draw that people can participate in. Our first draw is April 1st. No fooling is what we say. And I think the pot is up to $14,000 at this point.
For those that use One Care's transportation services on a daily, weekly, or monthly basis, it really is about that freedom that it provides that keeps them coming back for more.
I think it's pretty important because the need for transportation with seniors and people with disabilities is growing in our community.
A lot of our services are life or death, and I think people really need to understand that about One Care and what we offer.
In Clinton, Scott Miller, CTV News.
This is our device called Wearable Optimizer.
Sometimes big breakthroughs come in small packages.
It's actually very simple. We just lift the skin up briefly and applying the side of the needle down.
It sounds simple, but the research behind it is quite complex. The team at the University of Waterloo is closer to making life more comfortable for diabetes patients.
They monitor their blood glucose level is usually using the finger prick glucometer.
A process that can be invasive. Continuous glucose monitors in the form of wearable patches that penetrate the skin have been developed before. But what's on the market now needs some work, according to this team of bright minds.
So they're using metallic and solid needles, which are long, like usually 4 millimeters, and they would go into the skin. So these are painful because they can touch the nerves.
Instead, they've developed new hydrogen microneedle patches. They're less than 1 millimeter, so when they penetrate the skin, they don't touch any nerves, allowing patients to apply the patches themselves.
The interstitial fluid is another body fluid that we have beneath the skin. It has a good resemblance to blood, especially for biomarkers like ketones and glucose and lactate as well.
The added comfort allows the patches to be worn constantly, which helps reduce the risk of serious conditions.
So if the ketone levels go up, there is a condition, it's called diabetic ketoacidosis. And again, there is no continuous ketone sensor yet available.
The idea is to have the data transferred through the patch and chip to users' smartphones, or have it uploaded to the cloud for physicians.
We're looking for a lifetime of probably 10 to 14 days for them. The disposable part is the part that would cost around $1. So the reusable parts would be probably around $100 each, but that's a one-time cost basically.
Whereas researchers say current continuous monitoring patches cost upwards of $100 each, so far more expensive. This new and improved patch can be used for more than just diabetes patients too, thanks to help from McMaster University.
Monitoring of lactates in athletes. So athletes, they need to monitor their lactates to optimize their performance. But currently the way that they are doing, they need to stop their exercise, prick their fingers.
To bring the technology to the market, the team recently launched a spin-off company called Aptech Health, a move they hope will change healthcare forever. Spencer Turcott, CTV News, Waterloo.